Hello, everyone, and welcome to the Dr. R Show. We'll be coming to your living rooms weekly to discuss various health topics with the help of medical experts in their respective fields. Meet my two very special assistants, Megan and Christina.
And I am so excited because today is leg day.
And then inhale as you lower back down.
They will be with me every week to give us tips on healthy eating and proper exercise.
Stretch and keep yourself hydrated.
So welcome to my show as we both learn together. Welcome to the Dr. R Show. I'm here with Dr. Mark Prince. He's the Director of Gastroenterology at USMD Hospital in Arlington. Dr. Prince, thank you for joining us. I'd like to discuss the colon today and colon health. The way I like to approach it, first just talk about the anatomy of the colon and the physiology, how does it work, and what could potentially go wrong with it. So what is the colon exactly, and what does it do?
The colon's the last part of your digestive tract, and it's primarily useful for absorbing water in the food that we eat, and also storing waste until it's a convenient time for us to go to the restroom.
And how does it do its job?
It takes the leftover products of your digestion and gradually reabsorbs water as processes move through your colon, and the resulting remaining waste is stored until it's a convenient time to go to the restroom and expel it.
And what is the anatomy of the colon? What are the different sections?
The colon starts in your right lower quadrant, and we call that the cecum. There's the ascending colon that rises up, and then the transverse colon goes across your abdomen, descending colon down, sigmoid colon, a little further into the pelvis, and then finally the rectum is where the colon ends.
And how long is the colon?
The colon's approximately 4 to 6 feet long, depending on the person. It is a very flexible organ as it can stretch if it needs to, or it can collapse, much like an accordion, but between 4 and 6 feet in length.
And the colon, in addition to waste product, is also full of bacteria. How much bacteria does the colon hold? Millions
and millions of bacteria. There's numerous species of healthy, and then when we get sick, unhealthy bacteria in our colon. And the healthy bacteria really are essential for the normal digestive process.
About how many different species are there?
It's unknown really how many, millions and millions really, that could be in the colon.
And what is the role of bacteria in the colon?
The bacteria help break down of food products into the digestive process, much like a bacteria useful in a compost pile in your backyard. In your colon, it has similar effects to help break those down. And
what is it that produces gas in the colon?
The bacteria themselves. When we eat, the bacteria eat. The food that we generate is useful for us, but the bacteria actually make gas in their digestive process as well. When they eat what's left over from our food intake, gas is produced.
Now, is there any role of the colon with your immune system, your immunity, how you're able to fight disease?
Your digestive system is estimated to have about 70% of your total immune system is through your digestive tract, because we come in contact with so many pathogens in what we eat and drink. Not all in the colon, but certainly your colon has a big role in that as well.
So if your colon's diseased, your immune system's at risk of being weak, and you could get very, very sick.
You certainly could if you have a weakened digestive tract anywhere, including the colon. It could affect your immunity.
And what's the best way to evaluate a colon? Is colonoscopy the gold standard?
Yes. As far as looking at the internal lining of the colon, which really determines its health, a direct visual inspection with what we call a colonoscope, which is a lighted tube with a camera on the tip of it, is the most common procedure that's done and the most effective.
And who needs a colonoscopy?
Well, in general population, we suggest everyone over age 50 get a colonoscopy, primarily for colon cancer screening, because that's the best method to look for growths or problems in the colon. If you have symptoms, such as diarrhea, abdominal pain, bleeding, then your doctor may suggest you have a colonoscopy done as well to evaluate those symptoms.
And when you do a colonoscopy, what exactly are you looking for?
Basically, we're looking at the lining of the colon to see is it healthy, to see if it has the proper color and texture, looking for obvious problems, much like you would to go to a dermatologist to look at your skin to see if it's healthy. It's the same process that we see on the inside of the colon, but just because of its location, the colonoscope allows us to get that visual internal look.
And how often do you find something?
Quite frequently. Depending on the indication, the reason for the colonoscopy, if it's done for routine screening purposes, up to about a third or maybe even half of patients will have some problems that they don't know about that we find.
Well, yeah, I've had a colonoscopy myself. I think the hardest part's really the prep more so than the colonoscopy itself.
Yes.
Yeah.
The prep is very important. As you know from having your colonoscopy before, for us to see the internal lining of the colon, we have to have the patients flush the waste products out the night before. And that is the most frustrating part. But it's very useful and very important because if the preparation is not very good, then our ability to see the colon is very limited.
Well, we're going to need to take a quick break, and we'll be right back.
Hey guys, welcome back to Inside Fitness. I'm Christina and this is Megan, and today we are talking about yoga. Yoga is a really great way that you can strengthen and tighten each and every muscle in your body just using your own body weight. And not only is it a great exercise, it's also great for your mind so you can keep that balance in your life. So today I'm going to take you through a few poses because I know yoga can be sort of intimidating at times, so we're just going to kind of get you started here today. So the first pose that I want you to do is the pose that you can do anytime that your body is feeling strained or stressed or it's really talking to you. So the first pose is called child's pose. So Megan, what we're going to do is I want you to kind of keep your knees really parallel with your shoulders, kind of cupping your bottom in your feet. You're just going to stretch your arms out to the front of the mat and just put your head down to the floor. You can really just kind of relax in this pose, but make sure that you're engaged still. Make sure that your arms are active. So once you're done with child's pose, we're going to go into the next pose, which is up dog. So up dog, you're going to be laying flat on your belly. And this is really going to kind of get us started to do any type of yoga flows that you can see in any classes. So what you're going to do is your hands are going to be right here kind of at your shoulders, maybe level with your chest. You're going to push your body up. And for beginners, what you're going to do is you're just going to keep the rest of your body on the ground. This is really more of like a cobra. But for up dog, if you're a little bit more advanced, you're going to push your whole body off the mat and really engage the rest of your arms, keeping your shoulders away from your chin and just kind of putting the weight on the tops of your foot. From there, we can switch and go into downward dog. So you're just going to curl your toes under, use your lower abdominals to push yourself back. And sometimes this can really start talking to you. So what you want to do is you want to try to keep your heels as close to the mat as possible and keep your back as straight as possible. So if you need to, go ahead and walk your feet out. Just really get a nice good stretch in. And just like I was saying, we want to make sure that your back is nice and straight. So yeah, Megan, go ahead and push yourself back with the balls of your hands. And you can see that she's just making a good, nice straight line here, keeping her feet as close to the mat as possible. So when you're done with that, we can go ahead and come out of it. In some certain yoga variations, what they'll have you do is when you're in a downward dog position, they'll have you step or hop to the front of the mat. When you're stepping, we're going to get into warrior one, so you can just kind of put your feet in between your hands. If you're hopping, the point of hopping is to really kind of engage your arms. So when you hop, it needs to be slow and controlled. So we can go ahead and step forward or hop. We're going to go ahead and come up and we're going to go into warrior one. So with warrior one, I want you to take your right foot forward. We're going to take the left foot and make sure that the right heel is in line with the middle of the left foot and get a good little amount of distance there because we're going to kind of do a lunge. Square your hips forward to the front, arms in the air, and we're just going to lunge forward, keeping the right knee over the baby toe. You're going to really engage this and think about just tightening every muscle in your body and really be active in this pose. From there, we're going to switch to warrior two, which your legs are going to stay in the same position, your arms are going to come down, your hips are going to kind of square a little bit more to the front of the room. Go ahead and look over your right arm, just a little bit deeper. Let's sit down into that stretch. And then finally, warrior three, what we're going to do is we're going to come up on this leg. So Megan has a dumbbell there to use for stabilization, but if you're a little bit more advanced, then you can just be totally in the pose. So with the pose, what we're going to do, Megan, if you want to kind of get prepared, we'll have our right foot forward, and you're just going to try and balance, lifting your opposite leg up as high as you can and putting your arm in the air just for stabilization. So that's perfect. So one of the advanced versions is just go ahead and find a spot on the floor. When you lift up, make sure your straight leg is staying straight, everything, just one nice straight line. Hold, and then slowly come out of the pose. So that's a little bit for yoga today. There's several other stretches that you can do. There's several yoga classes that you can do. There's several DVDs that you can do. Yoga is really just about your body and your mind all at the same time. So make sure that you incorporate some of these poses into your workouts, adding that variety, and we'll see you right back here next week for Inside Fitness.
Hey everyone, I'm Megan and this is Christina, and today we're going to be talking about kale. Now if you're anything like me, the hardest thing to give up when dieting is chips. I love the crunchy and saltiness of chips, but I have found a great alternative by making homemade kale chips. They're so easy to make. All you do is put the rinsed kale leaves onto the cookie sheet, sprinkle with a little bit of olive oil, salt and pepper, and pop them in the oven at 350 degrees for 20 to 25 minutes. And I personally like to add a little bit of Parmesan cheese for the last 5 minutes just for a little extra flavor.
So we got actually ahead of you guys, and we already have some of our kale chips in the oven now, so I think they're probably ready.
Yep, let's go ahead and take them out.
All right. And it was amazing. When we first put the kale on here, it was like totally filled, and it just completely shrinks when you heat it up. Did you put any type of oil on them at all?
Just some olive oil.
Just a little bit of olive oil. So there you go.
And kale is a really good replacement for that TV snack like popcorn, and it's actually pretty packed with nutrients and vitamins. So first of all, it has folate, which is really important in creating new cells in the body. It helps prevent anemia and can actually help against heart disease. Kale is also a source of vitamin K, which is important in blood clotting and preventing excessive bleeding. Not to mention, it's high in vitamin A, which promotes normal vision, and also vitamin C, which is an antioxidant and helps boost your immune system.
That's pretty good, huh? They're so crunchy.
Just like chips.
This is my new favorite thing.
So let's get this out of the way, and we're going to talk about our summer spinach salad, which you can actually use kale for this as well. So we've got some spinach here, and we're going to put together a strawberry dressing. So we have a 1/4 cup of balsamic vinegar, 2 teaspoons of Dijon mustard, about 6 tablespoons of extra virgin olive oil, and then we're going to add some chopped strawberries if you want to add those in there.
And you can also use things like blueberries as well, right?
Yep,
It's
any
basically
type of berry, really.
I love blackberries too. There we go.
Okay, and let's go ahead and turn this on.
Perfect, yeah. So making your own dressing is actually something that you can do to help limit some of the preservatives and things that you would find in bottled dressing in the grocery store.
Okay, so if you want to pour this over the spinach.
Okay, thank you. That looks great.
And just to make it a little bit more summery, we're going to add a couple grapes and a little bit of walnuts and almonds.
A little bit of salt never hurt anybody either. Only a little bit. Everything in moderation. There's some grapes. And we're all set. So hopefully we gave you some new ideas today, and make sure to give kale a try.
We're back with Dr. Mark Prince. Dr. Prince, let's talk a little bit about colon cancer. How common is colon cancer?
Colon cancer is the second most deadly cancer in the United States. It's estimated about 50,000 patients each year develop colon cancer, so it's a big medical problem in the United States.
And who's at risk?
All of us really are at risk. The most important risk factor is our age. The older we get, the more likely we are to develop colon cancer. Our family history plays a role. If our mother or father had colon cancer, then certainly that increases our risk as well.
So what is the incidence? How much does it increase over time as you get older?
Every year it increases. We tell patients in general, starting around age 50, they ought to start thinking about, colon cancer screening options. But every year it increases.
So at age 50, what's the incidence of cancer?
It's pretty low at 50. At age 50, we will have several cases of precancerous issues in the colon called colon polyps. The actual amount of colon cancer is not very large at that point, but it increases from there.
And how does colon cancer start?
Colon cancer starts as a normal colon tissue that changes genetically. It becomes a bump in the colon called a polyp. And that polyp can be there for many years before it changes further genetically and becomes colon cancer.
What causes a polyp to form to begin with?
No one knows exactly why, but we know that genetic changes play a role. Your family history, certainly, you may have the tendency for that to happen. Also, what you eat or your activities, lifestyle play a role in forming that initial change.
And what are the signs and symptoms of colon cancer?
Colon cancer, when it initially starts, typically doesn't have too many symptoms. That's one reason why it's a fairly deadly cancer. But as it gets bigger and grows, common problems include bleeding through your digestive tract, changes in your bowel habits like constipation, maybe even fever or weight loss. Sometimes abdominal pain can develop.
So if you've waited to have symptoms, then you've waited too long.
Unfortunately, for some patients, that's true.
So what types of cancers are there?
The most common cancer in the colon is what's called an adenocarcinoma, a glandular cell cancer. When we say that word, we mean colon cancer. There are other types of cancers that can develop, but they're much more rare.
And what is the staging process for colon? Once you have colon cancer, there are different severities, different stages that
Yes.
one has to take into account regarding treatment?
Yes, there are. Most colon cancers are diagnosed with a colonoscopy, and then after that, we look for both local and then regional and then distant spread of the cancer throughout the body. So imaging like CT scan or PET scan are used, as well as a basic blood test to try to further define the stage. And then commonly, colon cancer will lead to surgery to remove the initial cancer, and that will really get definitive surgical staging at the time.
So if you do a colonoscopy and you find a polyp, then what
Yes.
do you do about it?
The great thing about a colonoscopy is we can find these precancerous bumps called polyps, and then we also can remove them immediately at the time of the colonoscopy. So it's not only diagnostic of trouble, but sometimes it can prevent or cure problems 20 years down the road.
And how often should somebody have a colonoscopy?
Everyone should start around age 50, and if it's normal, we suggest that you have a colonoscopy done once every 10 years. If you have previous polyps, have a polyp during the colonoscopy, or maybe have a family history of colon polyps or colon cancer, then we're going to shorten that interval to less than 10 years, typically 5 years. But it really has to be individualized per patient.
And how does one treat colon cancer when it gets beyond the polyp phase?
Yes.
You do a colonoscopy, you see this invasive tumor. What do you do about it?
The best treatment is if the lesion is large, and it typically would be in that situation, you'd have surgery, and a surgeon would remove a section of your colon, and then after that, determinations would be made if they're spread elsewhere, should you have chemotherapy in addition to the surgical treatment. And rarely radiation therapy is useful in rectal cancer, which is a subset of colon cancer.
And who typically treats colon cancer once you diagnose it?
Really, a medical oncologist is the most active and most involved in the whole treatment process after initial diagnosis and then surgical therapy.
So at which point would you do radiation therapy or chemotherapy after surgery?
If the tumor itself has really left the colon, it's much more likely to spread to lymph nodes and to spread elsewhere in the body. Those are the situations where chemotherapy might be more useful to get not only the initial tumor, but also get rid of some colon cancer cells in other parts of the body.
Now, is there anything you could do to prevent getting colon cancer besides having a colonoscopy?
Yeah, I think the best advice for patients really is try to have healthy living. We've found that people who have better diets, more fruits and vegetables, less meats, people who are more active, less sedentary, do better. People that don't smoke are less likely to get colon cancer. So there are some primary prevention measures you can take yourself to just try to be a healthier person. And then even if you're perfect, though, all of us can still have genetic risk for colon cancer. So that's the main reason why we suggest people at age 50, even if you're a very healthy a person eating a great diet, you still should have a colonoscopy to be careful.
Well, Dr. Prince, thank you very much. It's all the time we have, so we'll have to wrap it up. Until next week, we'll see you back at the Dr. R Show.